Podcast 4 of the Thorax series, the lungs. This podcast is going to detail the anatomy of the lungs and include the main features of their external surfaces. It shall also include details about the trachea and the bronchial tree. So each lung occupies a large portion of either the left or the right compartment of the thoracic cavity. The two lungs are separated in the midline by the mediastinum and are surrounded by the pleural cavities. So let's start by detailing the external features of each of the lungs. Both of the lungs have a coned apex that extends into the base of the neck. They have three surfaces, the costal, mediastinal and diaphragmatic, and three borders, the anterior, posterior and inferior. Now the costal surface is the largest and smoothest surface and sits against the ribs of the thoracic wall. The mediastinal surface is adjacent to the middle part of the mediastinum and contains the lung root or hilar. I'll return to the specific structures that enter the lung at its hilar later in this podcast. The inferior surface, which is also known as the diaphragmatic surface, is concave and is positioned on either the left or the right domes of the diaphragm. The costal and mediastinal surfaces meet anteriorly at the sharp anterior border. The posterior border is rounded and this sits against the angle of the ribs. The costal surface meets the inferior surface at the sharp inferior border. Each lung can be divided into lobes, with the right lung having three, the superior, middle and inferior. The left lung has just two, these being the superior and inferior. These lobes are separated by fissures, with each lung having an oblique fissure, and this runs inferiorly from the superior aspect of the posterior border to the anterior aspect of the inferior border. This fissure separates the superior from the inferior lobes. The right lung also has a horizontal fissure, and this extends from the oblique fissure to the anterior border and forms the middle lobe by separating the superior lobe into two. The left lung doesn't have a middle lobe due to the cardiac notch, and this is an indentation created by the heart. This indentation creates the lingula, a thin tongue-like tag of lung tissue that drapes down from the inferior border. Whilst most of the lung surface is smooth and featureless, the mediastinal surface contains the lung root or hilar and also several grooves. The hilar of each lung connects the lung to the mediastinum and allows the pulmonary vessels, so the pulmonary artery and vein, the bronchi, the bronchial vessels, the lymphatics and the autonomic nerves to enter and leave. If we look at the hilar, then it resembles a teardrop in shape, with a rounded superior portion and a narrow inferior portion which is formed by the pulmonary ligament. The pulmonary ligament is formed as the visceral pleura that is leaving the lung surface unites and runs over the lateral surface of the mediastinum. And you can imagine this arrangement by wearing a lab coat and pulling the sleeves to cover your forearm. If you abduct your fingers, then these can represent the dividing secondary and tertiary bronchi, with your hands, wrist and forearm representing the primary bronchi that are entering the lung. If you then gather the slackened cuff that is draping beneath your wrist, this resembles the pulmonary ligament, that layer of visceral pleura that is leaving the lung to become the parietal pleura. If we look at the hilar of the lung, then you should be able to identify the various structures that are passing into and leaving it. To do this accurately, then you need to ensure the lung is orientated properly. So make sure you can identify the rounded posterior border and the sharp anterior border, the coned apex and the domed base. Also make sure you know if it is a right or a left lung by counting the number of lobes present. So located within the hilum, most posteriorly, is the main or primary bronchus. This will be a large dilated opening that has toughened walls. You should easily be able to identify this, as the walls will contain fragments of hyaline cartilage, and these help to keep the walls open. More difficult to identify are the pulmonary blood vessels, the pulmonary artery and vein. Again, ensuring you have the lung orientated, the most inferior vessel in both the left and right hilar is the pulmonary vein. There may be one or two of these structures, but they are normally the most inferior structures in the hilar. This leaves the pulmonary arteries, and these are found closely associated with the bronchi and assume a more anterior and superior relation to the bronchi. So within the hilar of each lung, most posteriorly within the hilar, we have the primary bronchi, distinguishable due to the hyaline cartilage that you should be able to see. Most inferior within the hilar are the pulmonary veins, and most anterior and superior are going to be the pulmonary arteries. Also in the hilar, you should be able to recognise the hilar lymph nodes, and these are usually blackened due to the accumulation of carbon deposits, and these are randomly dispersed throughout the hilar. So staying on the medial surface of the lungs, you should be able to recognise a series of grooves, and these are created by the neighbouring blood vessels. So on the medial surface of the left lung, the aortic arch and descending aorta create a deep groove that starts above the lung root and then curves posteriorly and then inferiorly as the thoracic or descending aorta descends through the posterior mediastinum. Still on the left lung, the heart creates a large depression inferior to the hilar, and this is that cardiac notch. There are similar grooves on the medial surface of the right lung, and these are formed by the superior vena cava and its union with the azygous vein. So the superior vena cava creates a groove against the superior lobe's medial surface as it descends towards the hilum, and the azygous vein creates a groove posterior to the hilum, which then curves anteriorly to meet the groove formed by the superior vena cava. So finally in this podcast, I want to give some details about the tracheal bifurcation and the bronchial tree. The trachea is a tough fibroelastic tube that has incomplete rings of hyaline cartilage, and these help to keep the airway open. The trachea is positioned in the superior mediastinum between the aortic arch anteriorly and the esophagus posteriorly. And at the level of the four thoracic vertebrae, the trachea bifurcates into the right and left primary bronchi, and this occurs posterior to the sternal angle. The right primary bronchus is wider, shorter, and more vertical than the left, and as each primary bronchus enters the lung, they divide into lobar or secondary bronchi, which are associated with specific lobes. Each secondary bronchus then divides into tertiary bronchi, which supply specific parts of its lobes, and these form numerous bronchopulmonary segments, with each lobe having a specific number of these segments. Then within each of these specific segments, each tertiary bronchus divides into bronchioles, then respiratory bronchioles, and then finally the alveolar air sacs that form the soft, spongy lung parenchyma. So in this podcast, we've looked at the anatomy of the two lungs, their borders, their surfaces, and the lobes. And then finally, we detailed the trachea and its bronchial tree. In the next podcast, number 5, I'm going to detail the mediastinum.